Hi everyone. Today I'm going to talk a little bit about why I've been gone for a while, and obviously this video is about pyometra. For those of you who don't know what pyometra is defined as an infection in the uterus. The uterus is also known as the womb and is where the developing fetus is located. It is a serious and life-threatening condition that must be treated promptly and aggressively. Pyometra is often the result of hormonal changes in the reproductive tract. Following estrus or heat cycle in a dog, progesterone levels remain elevated for 8 to 10 weeks and thicken the lining of the uterus in preparation for pregnancy. If pregnancy does not occur for several estrus cycles, the lining continues to increase in thickness until cysts form within. The thickened cystic lining secretes fluid that creates an ideal environment in which bacteria can grow. Additionally, high progesterone levels inhibit the ability of the muscles in the wall of the uterus to contract. So how does the bacteria get into the uterus? The cervix is the gateway to the uterus. It remains tightly closed except during estrus. When it is open, bacteria that are normally found in the vagina can enter the uterus rather easily. If the uterus is normal, the environment is adverse to bacterial survival. However, when the uterine wall is thickened and cystic, perfect conditions exist for bacterial growth. In addition, when these abnormal conditions exist, the muscles of the uterus cannot contract properly. This means that bacteria that enter the uterus cannot be expelled. So when does pyometra occur? Pyometra may occur in young to middle-aged dogs. However, it is most common in older dogs. After many years of estrus cycles, the uterine wall undergoes the changes that promote this disease. So Ruby is 6 years old. She got it in December, probably early January actually. The typical time for pyo is 2 to 8 weeks after estrus. So what are the signs? The signs depend on whether or not the cervix is open. If it is open, pus will drain from the uterus through the vagina to the outside. It is often noted on the skin or hair under the tail, on the bedding and furniture where the dog has laid. Fever, lethargy, anorexia, and depression may or may not be present. Ruby had all of these. She did have some energy in the beginning, and then it slowly started to get worse and worse. I mean, she had less energy as it progressed. If the cervix is closed, pus that forms is not able to drain to the outside. It collects in the uterus, causing distension of the abdomen, which she had. You see that in the early pictures when she has a diaper on. The bacteria releases toxins that are absorbed into the circulation, and dogs become severely ill very rapidly. So Ruby was sick. She got really sick very quickly. She didn't eat for 2 weeks, and it was about almost 2 weeks before she was diagnosed and then went into surgery. So they are anorexic, very listless, very depressed. Vomiting and diarrhea may be present. She did not have vomiting till the very end. Toxins from the bacteria affect the kidneys' ability to retain fluid. Increased urine production occurs, and the dog drinks an excess amount of water. This occurs in both open and closed cervix pyometra. So Ruby did drink a lot of water. I figured, I really thought she was just having a heat cycle, but, she was actually very ill. Dogs that are seen early in the disease may have a slight vaginal discharge and show no signs of illness. However, most dogs with PIO are not seen until later in the illness. A very ill female dog that is drinking an increased amount of water and has not been sterilized is always suspected of having PIO, which is why I don't understand why she went past 2 vets without proper diagnosis, which almost caused her death, which I'll discuss in another video, separate video. So I want a very long video to talk about my experience with her having this disease and what I went through with it. It was very, very stressful. This is especially true if there's vaginal discharge or painful enlarged abdomen. So Ruby was in a lot of pain, but most animals, when they undergo a very traumatic sort of injury or illness, they can do one of both things. They can make noise like whine and stuff, or they can get very quiet. And Ruby was very quiet. She hardly made a peep, and she was just sleeping all the time, and she never gave me any trouble, and it was really difficult for me to understand what was going on with her. I just really thought she was having a bad heat cycle. That's what I thought it was. Dogs with PIO have marked elevation in white blood cell count and often have an elevation of globulins, a type of protein produced in the immune system in the blood. The specific gravity of the urine is very low to the toxic effects of the bacteria on the kidneys. However, all these abnormalities may be present in any dog with a major bacterial infection. If the cervix is closed, radiographs, x-rays of the abdomen will not identify the enlarged uterus. If the cervix is open, there will be often such minimal uterine enlargement that the radiograph will not be conclusive. An ultrasound examination can also be helpful in identifying an enlarged uterus and differentiating that from normal pregnancy, which both vets failed to do. So the first vet took a radiograph and said she had an obstruction of a bone that she had ingested, probably from a carcass that she had devoured in the backyard, which was not at all true. She didn't devour any carcasses. It was a bone that was edible bone that was in her food. And so she sometimes swallows those whole, and then she passes them later on. So she had found that through the radiographs, through the x-rays. And she just, this vet was very incompetent, I have to say. And so anyways, that went untreated. She went subsequently to another vet when I returned. And that vet didn't even do it was very far gone by then, and the vet did not perform an ultrasound, and she should have been in the OR that day, if not that afternoon, and he didn't do that either, and sent her home with antibiotics, which actually made her disease progress to, where she became septic and she almost died. And thankfully, the day that I had been driving around trying to find a vet, which I'll again explained in another video. This is all like, it's extremely upsetting thinking about it, actually, because such a powerful experience to watch your animal deteriorate, your pet. It's like your kid, it's deteriorating, and all these medical professionals are, they're supposed to be professionals and supposed to know their craft, and yet they have not a clue, and it's just very disturbing. Anyway, through the kindness of a vet that actually cleared her schedule to put my dog on the table and perform surgery on her, which took about, I want to say it was probably 3 hours, and bring her back to life, resurrect her from the galls of hell, really. I can't imagine the pain that my dog was going through with this, and it was untreated for so long. And it's upsetting to think about that. So how is Pyometra treated? The preferred treatment is to surgically remove the uterus and ovaries. This is called ovario-hysterectomy. Dogs diagnosed in the early stage of the disease are very good surgical candidates. The surgery is not slightly more complicated. The surgery is only slightly more complicated than the routine surgery or routine spay. However, most dogs are diagnosed when they are quite ill, so the surgery is not as routine as the same surgery in healthy dog. Intravenous fluids are often needed before and after surgery. Antibiotics are also usually required for a period of time after surgery. If your dog is a valuable breeding female, then please contact your vet to discuss alternative options. I've read about this, and I don't suggest that. I don't think it's a very good option for a dog. I don't understand a dog being valuable breeding female, whatever that is, but your pet is your pet. It's not a tool to, get profit from, or to, I guess, to continue its lineage, unless it's, through natural occurrences, like, your dog has got you have two dogs, one's male, one female, they mate, and then you have puppies. But if your dog's going through something like pyo, and to know what the repercussions of surgery is, and to go ahead and try to perform that in order to keep them intact, is I think it's cruelty, because it's a very, very painful procedure anyway, and pyo in itself is just a terrible, terrible thing to have to endure, and so no animal needs to be going through more pain than the disease already brings with it. So with that, I'm going to end this video, and there will be a subsequent video on my experience with Ruby going through this ordeal, and just talk a little bit about that and help you understand, that whoever's out there that's watching this video and maybe has is confused about what's going on with their pet, and these are some of the symptoms. Hopefully you come across this video and you're able to see that, or helps you to see that somebody else has experienced this, and to see that, it can be okay, it can be fixed, and life can go on. It's an expensive procedure if it's far gone. However, you will possibly be able to get your pet back, and life can be good again. But definitely from this experience, I would certainly consider spaying or neutering my pet in the future, just because this is something, it's a really sort of unavoidable to some extent, and because of the types of diets that dogs are forced to, now I guess not forced, but we are out of convenience have to feed dogs certain kinds of food and stuff, and that food is really what causes a lot of health problems in dogs. The alternative to that is making your own food, but we lead such busy lives that not many people are going to be able to afford, or to be able to have the time to make their own dog food. But I certainly believe that a lot of health problems in dogs, specifically cancers and things like uterine infections and all of those things, can be avoided if a dog has a more normal life and eats more normal food. I think it's really sad that, you know, there's some dog food and it's it is touted as being human grade dog food. Don't you think that all dog food should be human grade? I don't understand that. I mean, I wouldn't consider opening a can of dog food and consuming it. The dog food that she's currently on, which is Weruva, Weruva, there'll be other videos about this food, is actually human grade food, and a human could consume it. It just looks like chicken soup, and you just you could eat it out of a can, you know. So you could, I mean, not just your dog, you could actually share your dog's food. But under other conditions, like with other dog food, you wouldn't touch your dog food. So anyway, thank you for watching, and I hope this video has been helpful to anyone out there that's trying to scramble around looking for answers as to what's happening to their dog, the way I was several weeks ago. And I'll see you soon in another video. Thank you.